We are back here on Girl Talk. We are at the Wellness Institute, which is wonderful. I tell you what, you've really expanded. We are here with Miss Andrea Schultz. Thank you so much. Right name?
Yes, ma'am.
Andrea Schultz, right name? Exactly. Yeah. It's so good to see you. We've had a lot of fun talking.
Thank you.
And it's going to be an interesting segment today. We're going to be talking about women, pregnancy, pre and postpartum.
Yes, ma'am.
And some of the things from a physical therapy point of view that are really important.
Right.
I was telling you before, my daughter has a 9-week-old,
Yes.
so I'm really extra curious about this.
Yes.
Talk to me about this expanding field.
So a lot of practitioners are a little bit afraid of intervening with a pregnant woman because they don't know all the risks and specialty ways to position and treat them. So we tend to shy away from them. So it's nice to have a specialist who treats these women. As you know, your daughter may have had some pain, pelvic or lumbar during pregnancy and then in delivery. Of course, we expect that.
Yes.
But what we also don't realize is that the treatments that we use for the lumbar and pelvis in the normal population, the regular population, the non-pregnant, can be applied to the pregnant. We just have to be aware of our special conditions.
What would be the goals and objectives of being treated during pregnancy? Is it to alleviate the discomfort?
Yes,
to show
ma'am.
Is it really?
Yes, ma'am. So your body is going through, as you can imagine, a lot of changes in a very short period of time, and that puts a lot of stress on muscles and joints.
Okay.
We can help alleviate, improve your pain, and therefore make your pregnancy more enjoyable, hopefully, is our
which
goal.
makes sense.
Yes,
Okay.
ma'am. We're also looking to prevent some other issues that could occur afterwards. So urinary incontinence.
Okay. All right.
There's something called a diastasis recti, which is the separation of the abdominal muscle. So we can help to stabilize that if it's already begun or start to prevent that. Postural deficits, that thoracic kyphosis, lumbar pain, and everyone thinks, oh, well, this is pregnancy related, it'll go away after delivery, and that's not always the case.
It's really interesting because Molly says since she's had the baby, she finds herself in this position a lot from nursing and things like that. And and again, the incontinence and just getting everything back to normal, I guess is the right way of saying it.
Yes, ma'am. I mean, you're looking at trauma during delivery that can tear the perineum, which is that space, or if you have an episiotomy, you end up with scar tissue there that can cause pain with intercourse.
Okay.
That doesn't help things afterwards.
Absolutely. Well, you got a new baby, you don't feel good, you want to get, that makes so much sense.
Yeah.
Now, let me ask you a question about who goes and how I come.
Okay.
Can Molly just come in? Does she have to be referred by a physician? How's all that work?
In South Carolina, we have open access, which means that if you have commercial insurance, usually they will allow you to come in without any special paperwork beforehand. And if you're paying cash pay, you can walk in and we can treat you up to 30 days, and then we will get your physician to sign off that. Obviously, when we're dealing with the pregnant population, if you are a higher risk pregnancy, we would prefer that we get a note from your doctor to okay this first.
Let me ask you a question about timing. Her baby's 9 weeks old. At what stage or how soon after delivery do you recommend coming in to see if I'm in pretty good shape?
So depending on what's going on, a lot of the things you're talking about with Molly with her postural dysfunctions, we can intervene from day one, okay? Bring baby in and let's go through positioning for breastfeeding, carrying. Carriers are not meant to carry. Take your baby in, put it in the stroller, pop it in. They're really heavy, and then add a baby. It creates a lot of musculoskeletal issues that we can kind of teach you to overcome.
What's interesting for me talking to you is you've got 2 kids, 4 and 6, so you have experienced, you've practiced what you're preaching too, which is kind of fun. And then from a pelvic floor exercise, what you're telling us is, you know, when you're back to working out, you can do jumping jacks. We don't have to worry that we'll have some urine that'll be...
Yes, ma'am. You can start working on pelvic floor and preventing urinary incontinence during pregnancy. You do not have to wait till after delivery. Even those ladies who go through and have a cesarean can still have urinary incontinence because you carried all that extra weight.
Is that what causes it?
Sometimes it can vary. Obviously, the pressure during pregnancy puts a lot of strain on the pelvic floor, which is like the hammock to your body.
Got it.
So you can see how that's getting stretched out through the months. And then obviously trauma during delivery, just the act of delivery obviously stretches out muscles, ligaments, and fascia, and we want to tighten that back up and help prevent as much as we can beforehand obviously we'll intervene afterward.
Do you think that most of us are pretty knowledgeable about all this, or do we just, you know, I mean, at 64, I think we talk all the time about, you know, no more commando time. Is it, do I need to be that way? Are there exercises we can do at this age?
I think we need a lot more awareness.
Okay.
I think we've come to a point where people, because we're talking about a little bit and we notice that it's common, we think it's normal. And that's not necessarily true. So we think, oh, if this happens to all our friends, this must be the way it is, and that's not where we want to be. We want to be working to intervene and prevent this.
Does this ever happen to men too?
Yes, ma'am. A lot of the times it's mostly after a prostate intervention, whether it be a TURP or a resection. So any sort of prostate-related surgery, based on just because of where the prostate is positioned in relation to the urethra and trauma to the urethra during those procedures. So we do see men. We also see men for pelvic pain. So our women come to us with pelvic pain related to scar or muscle spasm. Men can have that happen as well, and they are not as vocal to their doctors a lot of times, and so we see fewer of those, but the prevalence is still out there.
And I think a lot of this is about demystifying and educating, and some of the things that we think are embarrassing are really more ubiquitous. They're out there for a lot of people, and the more voice we give to the opportunity to feel better, and some exercises that you can do, or some physical therapy interventions, the better off I think we are.
Yes, ma'am.
You are great.
Oh, thank you.
Wonderful. Will you come back and talk to us again?
Yes, ma'am, anytime.
You are wonderful. Thank you
me.
all for joining us here on Girl Talk. Please have a wonderful week. Bye-bye.